Congratulations on your new braces! Throughout the course of this video, we will walk you through some basic tips and tricks so you can get the most out of your braces treatment. Ready? Let's get started. Braces are composed of many parts, and it's important to know the proper terminology so you can correctly identify each piece. Braces consist of brackets, arch wires, molar bands, elastic hooks, and ligatures. Brackets are connected to the bands or bond directly with the teeth and hold the arch wire in place. The band is a cemented ring of metal that wraps around the tooth. The arch wire is exactly what it sounds like, the wire arch that is tied to all of the brackets and creates the force necessary to move your teeth into their proper alignment. The arch wire is anchored to your teeth through molar bands, which are fitted rings that go along the back teeth, also known as molars. If your braces treatment includes the use of rubber bands, your braces will also have elastic hooks. These hooks aren't actually elastic, but are instead metal hooks attached to your braces where you can hook on your rubber bands. Each bracket is attached to the arch wires with something called a ligature. Ligatures can be made of twisted wire or a tiny elastic. The elastic can even sport your favorite color. Sometimes, a wire in your braces may come loose and feel more pokey than the rest. It can be annoying, but with the right tools, you can fix it. Here are a few quick fixes to try if this happens to you. Try using a cotton swab or a pencil eraser to press the wire back on the tooth. Sometimes all you need to relieve that uncomfortable poking sensation is to redirect the wire away from the sensitive areas of your gums and inner cheeks. If the wire has come out of the bracket, use tweezers to guide the wire back in. You might even try bending the wire so the pointed end is resting comfortably against your teeth or gums. If the wire is still poking or particularly long, use a pair of clean nail clippers to snip off any excess and then try one of the first two tips again. When in doubt, cover the wire with the provided wax by applying a small amount to the affected area. Make sure to keep the area dry or the wax may not stick properly. This should soothe the discomfort you feel while you schedule an appointment with our team so we can fix the issue in the office. Having braces means paying extra attention to your dental hygiene. We recommend you keep an Orthodontic Essentials kit handy for at-home and on-the-go cleanings. First of all, you'll need a toothbrush, of course. In addition to your regular toothbrush, we recommend you keep a travel brush and case in your purse, bag, or backpack to use when you're out and about. Next, we recommend you keep a proximal brush, floss, and floss threads to access the small, hard-to-reach spots in between your braces and your teeth. Proximal brushes can be used to reach between your teeth and up into the areas where the arch wire makes regular brushing difficult. We also suggest you keep your provided wax on hand both at home and when traveling. Wax is the simplest way to soothe discomfort or poking until your provider can remedy the issue, so it's good to always have on hand. Finally, consider keeping a mouth mirror in your regular dental hygiene toolkit. If you're experiencing discomfort or suspect any kind of problem with your braces, a mouth mirror will allow you to view your own teeth much more clearly. This particularly comes in handy when adjusting wires or applying wax. Now that you have braces, you may be wondering what's the best way to keep your teeth clean and healthy. It's true that having braces means paying more attention to your regular brushing and flossing habits, but it doesn't have to be difficult. Just keep these tips in mind to make sure you're still getting a thorough cleaning. When flossing, use the floss threader to hook your floss into the loop. Then, insert the floss threader behind the arch wire so the floss can access the spaces between your teeth as normal. When it comes to brushing your teeth, make sure you're brushing from multiple angles to ensure you're accessing every spot. Choose a soft toothbrush and use circular motions on all the surfaces of your teeth and gums for a thorough cleaning. It's not just your brushing habits that need a makeover, though. Now that you have braces, you're going to need to be more careful about what you eat. A good rule of thumb is to avoid all foods that are hard, sticky, and have lots of sugar. Hard food can damage your wires, causing them to bend or break, or even cause the bands and brackets to become loose. Also avoid any bad habits involving your teeth, such as nail biting, picking at your teeth, or chewing on bottle caps, pens, or pencils. And there you have it, a basic how-to for your brand new braces. Braces may take some time to get used to at first, but with practice and patience, you'll be flying through your treatment in no time. It's important for patients to be seen on a regular schedule to keep treatment moving, generally every 4 to 8 weeks unless stated otherwise. You may expect some soreness in your teeth as they begin to move. This period can last about 2 to 3 days. If you wish to take something for the soreness, pain relievers like Tylenol or Advil are very effective. If you are a parent or guardian and would like an update on your child's progress during treatment, let the front desk know when you check in, and Dr. Grosso will be happy to meet with you. Remember to maintain your visits with your dentist for regular dental checkups every 6 months. If you have any questions or concerns about your treatment, please don't hesitate to reach out. We are always happy to help. If you'd like to learn more about Dr. Lindsay Grosso and her team, pause the video here to read a few words from them or take a look at their bios on our website, www.grossoorthodontics.com. Congratulations again on starting your treatment, and as always, we look forward to seeing you at your next visit.